Ready? Hey, shoot, I stand up.
All right, good evening, people. Welcome to FKC. Take your seats and we'll soon get started. For those who haven't been before, we do a regular show every couple of weeks where we cover a nutrition topic. The last few weeks has been about bone health and joint health. So we have a trilogy of that going on. Tonight is the last night of that.
Last night?
The last night of bone and joint health, yes. Actually, the next kind of topic we have is youth health, so kind of children's health. And we're going to feature that on not the July 4th week, would have been July 5th, but the Thursday after that, which is July 12th. So July 12th will be the next meeting in 3 weeks' time. So I'm going to warm things up with Randy. Guess you're right here.
Right here now.
Okay, so Joint Again. I hear you have an interesting testimony about Joint Again. Not you personally. It was somebody else in your family. Not your wife. Another person in your family.
A small person.
A small person with 4 legs. I'm interested. Come and share the story.
All right. Okay, this is the veterinary division of FKC. Actually, we've got a little Pomeranian we've had for a while. Not so little, he turned into a little fat body, so he probably, for prevention, we decided to try giving him some Joint Again. So I give the dog half a pill of Joint Again every day. And on the second day, he's still fairly young, he's maybe 8, 10 years old. He runs around like a puppy, where he would come down the stairs in the morning walking slowly. Got to coax him down, now he runs down the stairs, runs up the stairs. Because I heard about that from one of our other members, Mel and Baby, because they had an old German Shepherd. They tried that with a 19-year-old Shepherd, which is very unusual for a big dog. So we tried it with our little guy and it works.
No.
So I guess if it's warm-blooded and it walks, Joint Again will work. It worked for me, there's proof of it.
Did you smash it or how did you do it?
Yeah, I mean, he's 15 pounds, so I cut it in half and chopped it all up and mixed it with a little food. But you can't get him to drink right away, so you just take your chances. Yeah. But it works, so we can do veterinary improvement as well.
Okay.
You can applaud now.
You can also use it for hemorrhoids.
How do you apply it?
It's been tested. Use it like a suppository.
I don't know about that.
Yeah.
Dr. It's been tested.
That's a testimony for someone else, I think.
It's been tested.
Any volunteers? Okay, I thought that'd be a fun way to get a start this evening.
Oh, was that for me?
That's a gift for you, yeah.
Oh, thank you.
So anyway, that was just a bit of amusement. But, no, it's just interesting that all these ingredients, work on any kind of warm-blooded person. So why not? Give it a go. Anyway, enough of 4-legged people. A 2-legged person, Dr. Kane. Come on, finish off our bone health.
Thank you, Jason. Thank you, everybody, for showing up. Really appreciate it. And thank you, FKC, of course. And thanks for members and new members. Okay. While we get this thing set up, we got a lot of exciting things planned. As Jason mentioned, we are going to start, actually, our next meeting will be, well, I'll be here, will be July 12th, which will be 3 weeks from today about. And we're going to start talking about youth health. And just to preempt what we'll be talking about, we're going to talk about a lot of the products that we have, and particularly in terms of what makes sense for the young as well as the old, because remember, prevention really is the key, and you're never too young or too old to start. So we want to make sure that we integrate a lot of parents out there and things of that nature so we can see what makes sense. And we're going to finish off today with bone nutrition and health. We've talked a lot of some of these things in the past, but I just want to review it for those of you new out there and some of those who have not been. And let's see if we can get this thing rolling. Give us just a second. Okay. So, is it the first slide there? Yeah, great. So anyway, what is the importance of bone health? We know that. We talk down to bone health. There's a lot of different things that comes to the bone. I say this many times. Many people think that the bone is just like a solid piece of a bone. It's actually a living, breathing tissue. There's a lot of elements to the bone. There's lots of different specialized cells that make up the bone. There's a lot of disease processes that affect our bones and joints, and it gets quite complex. So I try to make it as simple as possible so we understand it. We've talked a lot about this. We have osteoporosis, we have arthritis, and these are probably the ones that affect most of us worldwide as we age, and even at younger groups. And again, affect a significant number of the adult populations. And again, as the baby boomers are growing, as we are aging more gracefully, we're going to run into these kind of problems with our bones and joints. And also we do a lot of really, really intense supplementation, exercises, and the proper things to minimize the effects of these type of things that can occur. And what happens with a lot of these issues with osteoporosis arthritis? Pain, loss of mobility, independence, limited activity. And remember, one of the most important things that we have to know is osteoporosis, which is so prevalent, not only here, but worldwide, is actually a preventable disease. It really is preventable. People don't realize that it's a combination of exercise, weightlifting, passive range of motion, as well as supplementation and certain other things, body weight, etc. like that. So therefore, a lot of these arthritic changes that occur that are very, very common in a variety of settings can be prevented and or thwarted off with a proper education and supplementation, okay? So what is arthritis? It comes from the Greek word named joint. It's inflammation or infection. There are many types of arthritis, but the bottom line is it affects the joints and the surrounding tissues. And there's a multitude of different types of arthritic conditions. And did you know that this is just from Canada alone? We do these things. 4 million Canadians suffer from arthritis, 1 in 6 adults. It's the same here in the United States, about 30 to 40 million actually. Expected increase about 1 million per decade. Most of the sufferers are under 65 years of age, okay? So it's just amazing to know that it's not just disease of extreme elderly, it's disease of all ages, okay? And what is osteoporosis? You know, people get confused with the terms. Arthritis, osteoarthritis, osteoporosis. Listen, this should make it simpler. This would be basically, osteoporosis basically is a metabolic bone disease by low bone mass. Think of it as just a very thin, weakened bone, okay? So for example, the bone is made up of a big matrix. This would be the lumbar spine. This would be a normal type of bone. You see all the trabeculations and how it's almost nearly filled. In osteoporosis, as you can imagine, there's a lot of bone resorption, loss of bone. That's the basic concept from that. And again, osteoporosis results from not having enough bone tissue, okay? Low bone density or low bone mass. Okay, or a very weakened bone, different from arthritic conditions, which are generally more inflammatory conditions, okay? But both of them will affect us very similarly. Pain, decreased mobility, but each one of them can be treated a little bit differently, okay? And again, it's also called the silent thief because there's no symptoms. As we know, a lot of elderly people start arching their back this way and having these type of issues, basically due to the fact that they're having multiple little fractures in their spine and they're arching the back and tons of fractures, deaths, etc., etc. And more women die each year of osteoporotic fracture than from breast and ovarian cancer combined. And I thought that was a very interesting fact. So, of course, breast and ovarian cancer is a serious problem, but more people die at older age, particularly women, also men as well, from just falling down, getting a fracture, and a complication of such. So we have to understand that the multitude of this disease is tremendous, not only affecting lifestyle, but in terms of volumes of people. So from a medical economic standpoint, as well as from a physical health standpoint, it's so important that we understand the supplementations, especially when I mentioned that osteoporosis can be prevented. The computer just went off there. So who gets osteoporosis? Let's see, 1 in 4 women over the age of 50, that's 25%, okay? 1 in 8 over men over the age of 50, okay? Men in osteoporosis, the problem with that, most people think it's a disease of the women, but it's not. So most of the men probably have similar to women, but they're usually underdiagnosed, inadequately researched, and other type of things as well, or develop other heart diseases, etc. So the bottom line, it does affect women more than men, but it does affect men almost as much as women, and the bottom line is men are mostly underdiagnosed, okay? Does anyone know why women are more affected than men? Does anyone have any idea?
Is it because we give birth and we use a lot of calcium when we give birth?
Well, yes, something to do with birthing, has a lot to do with hormonal balances, changes with estrogen, progesterones, yes.
Smaller bones.
They also have smaller bones, that's right. So it's a combination of everything, hormonal effects, lifestyle,
part of the reproduction facilities. In addition to that, also the fact that a lot of women, at least years ago, were doing weightlifting, these type of exercise, as well as smaller bones and smaller frames. Make sense? So it's a combination of a lot of things, it's not one thing, okay? So you know, God does discriminate in one way or another. And for some things, for example, men will get heart disease earlier than women generally, but then women will get osteoporosis usually generally earlier than men. So it's that's how it goes. But that was a good answer, yes. So, just to show you about bone disease, I mean, I just brought this as Evel Knievel. We all remember him. He passed away not that long ago. I brought it because, you know, Randy loves this guy. But anyway, bottom line is, look at all the fractures he's had. And he's survived many times. But you see skull, nose, teeth, jaw, right knee, right shin. So he's survived a lot of these things, you know. And it's hard to see, but these are what he's fractured, broken, replaced, broken multiple times. And he's an anomaly. So he's someone that actually people have studied over many years in terms of bone regrowth and resorption and all that. And one of the things that we learn from people like Evel Knievel and things of that nature is that no matter what happens, when your bone breaks, you fracture your bone, even if you survive the complication of, you know, the healing process and the problems, it's always going to have a problem down the road. So, you know, obviously the younger you do it, the bone can grow adequately, but any type of trauma to the bone, whether it's lack of oxygen, lack of blood supply, an infection, you know, that can give you osteonecrosis, things of that nature, can become very chronic indeed. Okay? So that's why, you know, when if you go to the emergency room, they have a difference when you fall down and you, let's say, break a bone. If that bone is basically exposed to the air and comes out of the skin, it's considered an open fracture, because once it's exposed to air and bacteria, it's very, very hard to treat those. And a lot of those people develop long-term arthritic changes. Usually open fractures versus closed fractures, which are still maintained within the body. Does that make sense? So we have a lot of younger people who've developed motorcycle accidents, car accidents and stuff, who've had multiple fractures or very bad strains, who develop arthritic changes at a very young age. And usually when you take a good history, you find out that they've been in multiple traumas or something of this sort. It's kind of interesting. So again, the loss of this bone density and structural weakness leads to bones that can break under the slightest strain. And it's really, really, really important. The hip being the most devastating. Up to 20% of women and even men will die as a result of complication of this fracture. So one of the biggest complications that we're concerned about with osteoporosis, besides the fact that the people are weak and they don't have much energy or decreased range of motion, is these fractures are really, really high risk of morbidity and mortality. Okay? And I forget what the percentage is exactly, they're saying 20%, but generally someone with osteoporosis who falls down, whether it's a hand fracture or a hip fracture, they may not die from the broken bone, but from the complications, pneumonia, embolism, a lack of movement, clot, etc., etc. So something that may be trivial to many of us here, just like a diabetic would have, like for example, something that would be very trivial to us would be very, very detrimental to an osteoporotic or someone with a really bad bone disease. Just like if you're a non-diabetic and get a small cut on your foot, usually nothing will happen, you put a bandage, you'll be fine. To a severe uncontrolled diabetic, a small trivial infection on their toe is going to do loss of life or limb. Make sense? Okay. Super. So again, bone is a living tissue, that's what I want to get out of that. There's different types of cells, there's osteoblasts and osteoclasts, and that's really the thing. And one of the most important things in the slide, it's a busy slide, I just want to know that most people achieve their bone mass by age 20. So by age 20, you pretty much have your maximum bone mass, and usually if you with exercise you can maintain it to 35 or 40, and then after that it starts decreasing, okay? So we want to minimize that decrease and prevent any complications, okay? It's really important. And just so you know that women lose bone at an accelerated rate during the first 10 years after menopause, 2 to 5% per year. That's a lot, okay? That's a lot. So what are the 4 factors that contribute to bone health? Nutritional supplementation, which we'll talk about briefly, physical activity, genetics, of course, and hormones, okay? So that's what we talk about. When it comes down to hormones, it's quite complex, but there are different hormonal aspects with women and with estrogen, progesterone levels, and different levels that contribute towards bone density, because that's how the bones work. There are genetic factors, of course. If you come from a family where everyone's got osteoporosis, osteopenia, a lot of the inflammatory arthritic changes, there's a good chance that you may develop that at an early age. But remember what I said, with osteoporosis and a lot of the other bone and joint diseases, there's a lot of things that we can do to prevent them. They're preventable, many of them. And of course, physical activity, we've always talked about it. A combination of both aerobics and also weightlifting and pressure against the joints over time is very good for you. Excess is no good. Arnold Schwarzenegger, these things no good. Okay, so everything within a reasonable amount. And one of the most important things that we've noticed is going back to the basics, that one of the most important factors for bone health are these simple minerals called calcium, magnesium, as well as vitamin D. And we have that at FKC. And the right combination of those will help, in addition to diet, exercise, maintain very, very good bone health. Okay? And what we basically know is that calcium magnesium, for example, the calcium is excellent for the bone. It helps in terms of clotting, muscle contraction in the heart. So calcium has a lot of other function as well, but we know it helps with the absorption of vitamin D and keeping bone strength. And it's true that a lot of people do not drink dairy these days. There's been a lot of things against dairy, and there's a lot of people who do not live in areas like California where there's sun. And so a basic element like, for example, calcium, they have insufficient levels of. So right away, their bones are going to deteriorate really quickly. So believe it or not, everyone should be taking a supplementation unless they're drinking lots of calcium and things of that nature. But the bottom line is, there's no question about it that calcium is key for bone health and bone growth, and it also has these other functions. Vitamin D, we know, is very important, along with sunlight and milk products, helps convert it to the active vitamin D to help with your bones and absorption. So you get the calcium and the active vitamin D. Magnesium is extremely important. It's also used as a muscle relaxant, but when it does the magnesium at the right doses with calcium, it helps absorb the calcium. We've talked about this many times before. You can take a medication, but for some reason, whatever the reason is, whether the pill is not the right configuration, or the acidity may be preventing, or if you take it with another medication, it may not absorb. The key thing is no matter what we put in our mouth, it eventually has to get absorbed into our bloodstream through our intestines. And so by adding magnesium, as we know, this is something very well known, obviously this helps with the absorption of calcium to maximize the calcium. That's why a lot of formulations have both calcium and magnesium, particularly for bone health. And again, it's all about having this synergistic effect of all three working together, the calcium, the vitamin D, and the magnesium in the right proportions to maximize the amount of the absorption of these minerals that basically will give you the ultimate bone health, okay? And again, what about calcium loss? What happens when we have calcium loss? Again, it increases with age, osteoporosis, menopause in women, hormonal imbalance, and other diseases. And again, there's over 1.5 million osteoporotic bone fractures a year, just from osteoporosis alone. Here's a typical X-ray. It's hard to see back there, but these obviously you can get it. Here's a fracture, okay? You can see the two bones broken there. And this is what a trabeculation of a bone looks like. Remember, a bone is a living, breathing tissue, always continuously remodeling, absorbing, and reabsorbing, okay? And again, what are some of the common joint and bone disease drugs? They can be very harmful to you. I've mentioned this many times before. People have pain, they have decreased range of motion, whether it's due to osteoporosis, arthritis, a combination of such, strain, etc. They're given usually some type of anti-inflammatory, aspirin, ibuprofen, as we know, Advil, even as much as the steroids to decrease inflammation. And again, is that doing any good for us? Absolutely not. Actually, steroids will actually make the bone lose bone density even quicker. It's one of the biggest complications, one of the bigger problems with steroids. So the bottom line is, what we're seeing here is a lot of the drugs that are used for pain relief, increased motion, not only for other problems, but especially for joint and bone disease, is actually causing more of a problem than not. And not just by just relieving the pain and having the bones move together, but by taking steroids and these other medication, you're blocking a lot of activity of the bones to reproduce and keep their strength, particularly in osteoporosis, to keep the density up, okay? So there's other factors involved as well. So what are the risk factors? We've talked about maybe that being a female, believe it or not, is a risk factor. Just being a woman is a risk factor for osteoporosis, okay? Or age 50 or older, prolonged hormonal imbalances, past menopause, not enough calcium in your diet, insufficient vitamin D, not enough physical activity, low body weight, extremely low, thin, small boned, Caucasian or Asian ancestry due to the small bonage, smoking, history of hyperthyroidism. There's just so many risk factors, and the bottom line is, again, genetically we can't do anything about it, but we can exercise, we can take the proper supplementation, as well as also do the right things and the supplementation that we talked about that will essentially reduce your risk of developing it. And what are some of the risk factors you cannot change? You can't change your gender. I know people try these days, you know, right? Chastity Bono, you know that one, right? I'm not saying that, but you really cannot change your gender from a medical standpoint, from your bone standpoint. I mean, there's things you can't do. Age, we can't change our age. We can't change our genetics. We cannot change our ethnicity. As much as people try, you cannot from a genetic standpoint. But there's the things we can change, very simple, and these are most effective. Nutrition, we know about that. It's not just about calcium, magnesium, or joint again, or other supplementation. It's general nutrition and supplementation, smoking and the cessation of smoking, or alcohol and other kind of type of drugs. Physical activity, these are things that we can change. And again, if we just change these three simple things and know what to change in it, we can prevent a lot of things, not just osteoporosis and osteopenias and things like that, but a lot of different things. And we stress this all the time. But we do need help with it, because a lot of times just physical activity and exercise alone and eating right is not enough. We talked about it. We need supplementation to enhance that absorption, because as we get older, our systems don't work as well. So we really need to take the supplementation to maintain the best we can our activities. Okay? And just real briefly, how's osteoporosis diagnosed? So I just want to show this quickly for those who don't know. There's all different types of tests. There's a bone densitometry test. It's painless. It gives a snapshot of one's bones. It can tell you if it's got low bone density. And again, the two sites of measure, usually the hip and the spine, that's very commonly used to diagnose osteoporosis. They just to know there's different tests, just you have to memorize this or know this, but there's T-test, Z-test, score ranges, and you basically come out with a number. So usually when it comes out with a number, the most important thing is someone goes and gets all these tests, and they say, okay, my test came back, and what did you get? And they said, well, I'm not sure if you're between +1 and -1, okay? That means you're okay, 0 being the score of an average. So if you score 0 for your age, that means you're okay, okay? Then what osteopenia is the step right before osteopenia here, is the step right before osteoporosis, okay? And again, these are decisions that are made over many years when we consider osteoporosis. It's a man-made decision, but it's been standardized for years. So if your score is between -1 and -2.5, okay, that means mathematically you're below the standard deviation, you've got very thin, brittle bones, and you're on the way to osteoporosis. That's osteopenia. Once you get scores from -2.5 or less, okay, then essentially you get diagnosed with osteoporosis. So osteoporosis is a diagnosis that is made through these tests. There's other variations, but I just want to give people here an idea of how we come up with someone who has osteoporosis. We don't say, oh, you're older and your bones are thin and that's it. There are actually parameters and tests that are actually quite accurate. The good news about it is that people who are, let's say, in this category, even this category, can actually improve by taking supplementations, diet, and exercise. So if you end up over here, you can twist up over here, okay? If you really do some changes. But we want to try to prevent these things if at all possible and not get to this step and try to reverse it. Does that make sense? It's much harder to reverse it because age is against us, a lot of things are against us. And again, there are a lot of drugs that are used to treat osteoporosis, not just supplementations, but they all have side effects. There's biphosphonates, there's hormones, there's selective estrogen receptor modulators. You don't have to worry about all of them. And some of you see these names, Fosamax, Actonel. And there are medications for this, but if you can take a supplementation and do physical activity and other changes first before you get into the medications, not only will you save a lot of money, but trust me, a lot of these things have severe side effects. Not to say that they're not useful, and not to say that certain people need it, but I think the key thing basically is we're talking about prevention. Let's see if we can get away from that altogether, okay? And again, ensure good nutrition. I keep saying that. What are the good nutritions? Well, very simple. Eat foods high in calcium. Some dairy sources, a lot of vegetables, broccoli, collards, kale, bok choy, a lot of fish for omega-3s, a lot of reasons, especially the oily fishes, the salmon, the sardines. They're exceptionally good for you, okay? Certain foods increase calcium loss. For example, people who drink a lot of caffeine or salt will actually lose calcium, okay? So it's not only what you need to take, it's what you need to avoid as well, okay? So you could be doing all these things, but if you have high salt diet, you're having too much proteins, you're having high caffeines, all these other type of things, you're actually counterbalancing your good nutrition. So I'm not saying you can't have caffeine, you can't have salt, but you want to minimize those things. Does that make sense? Okay? And what are the calcium requirements? You know, these are different requirements and dosages that's recommended, okay, at different ages, and the slides will be available. And there's calcium supplements as well. There's carbonate and citrate, but you don't have to worry about that. As long as you take calcium, mag, vitamin D, you'll get the sufficient calcium that you need. And again, back to vitamin D. Calcium is not absorbed in older adults without vitamin D, so you have to have the combination of both. And people think, oh, if I drink a glass of milk yesterday, it should be good enough. No, it doesn't work that way, not at all. And again, what are the sources of vitamin D outside of supplementation? We know that sunlight, just a little bit. Milk fortified with vitamin D, again, those fishes, those oily fishes, the mackerel, the sardines, the salmon, multivitamin, vitamin D supplements, i.e. calcium, mag, vitamin D, just to guarantee you have it all, okay? It's really important. And again, what's the benefits of physical activity? Healthier bones, better coordination and balance, improved muscle strength, increased endurance, and basically improved posture and better quality of life. So we need to treat these issues, you know? We may not even know it. That's why it's called a silent threat. A lot of people walking around osteoporosis or hypertension that don't even know they have it. So the bottom line, we all need to get checked out and make make sure we do the best. And again, with our posture, I don't want to go through it. When you have poor body posture, you have decreased respiration, and you do less exercise, you have more pain, decreased range of motion, and it all basically goes down to a vicious cycle. Not a good ending. Does that make sense? Okay? So one thing that may seem just a little trivial or a little bit inconvenient contributes to a lot of other factors as well, which is really important, and that's going to happen. Increased risk of falls, back and neck pain, rounding of upper back, protruding abdomen, you have difficult respiration, decreased digestion, on and so forth and so forth, which has been shown physiologically over many, many years. So what are some of the exercise precautions, real briefly? They got to be tailored to the individual health status. Before anyone goes on any exercise program or any type of severe change in lifestyle program, they must consult their physician to make sure they're up for the task, okay? And again, you want to do excessive compressive stress must not be put on a weakened bone. So people think, oh, I've got osteoporosis, I'll do a lot of weightlifting on that bone. You can just actually just cause yourself a fracture. So it's all about moderation, okay? Avoid high impact exercises. People with severe osteoporosis should not be jogging 30 miles a day. There are other exercises that you can do, okay? Avoid activities where there's a risk of higher falling. You know, a lot of the elderly people, dizzy or whatever it may be, you want to be very careful. There's a lot of activities out there that in the gym or even other places that you can do that are actually risk factors, that you're trying to do the right thing, but you actually cause more harm than good, right? So it's got to be in a supervised situation. And again, it should be supervised by a competent healthcare practitioner, initially at least, to get you going in the right direction. Because remember, it's a lifelong change. It's not a weak thing and you're cured. It's a lifelong change, okay? And again, just real briefly, just to finish things off, when we talk about arthritis, there's different types of arthritis. There's a lot more. Okay, there's rheumatoid arthritis, which is pretty much autoimmune disease. There's polymyositis, there's polymyalgia rheumatica, infectious arthritis, gout. Each one of them is a little bit different, but essentially it's just inflammation in the joint spaces. And there are different treatments for them. But again, a lot of the same things that we're talking about in terms of osteoporosis go hand in hand with arthritic changes, okay? And osteoarthritis, not osteoporosis, is the most common form of arthritis, okay? Again, inflammation we're talking about. Affects 3 million Canadians and over 30 million Americans. And it basically it just destructs the cartilage and the joint spaces and is extremely painful. So again, one of the key things I want to take off here is that overweight people are greater risk for developing osteoarthritis, that's OA, than average weight. A lot of the extra weight puts a little too much strain on our joints, okay? We're switching over from osteoporosis to osteoarthritis, but a lot of the things are very similar and go hand in hand, okay? And again, management of the osteoarthritis, I just want to put this into completeness. You want to alleviate the pain, you want to improve movement, you want to maximize quality of life, you want to strengthen endurance, and a lot of those orthopedic changes, again, there is glucosamine, there's joint again, we have products for that as well, okay? And again, you want to protect the affected joint. There are other things that we can do, orthotics or special types of shoes or devices that can help. But again, those are only temporary. We want to solve the problem, okay? So for example, if we have decreased glucosamine or decreased fluid between our joints causing us irritation, we want to take a supplement with glucosamine and other things such as joint again, okay? If we have weakened bones, osteoporosis, we want to make sure we get the right vitamin D, calcium, and magnesium, not rely on that. Did we take a glass of milk? Do we need to take magnesium here? Do we need to go out in the sunlight? We just want to have something that we take so we can be insured to prevent us from having those problems. That's the key. And again, there's different types of exercises. It's all about range of motion. And again, moderation. Everything is about moderation. It took many years to develop a lot of these issues, these arthritic problems, these osteoporosis problems. The bottom line, we want to moderate and reverse it slowly in case we start developing signs of it. Okay? And again, poor sitting posture, slouch position, there's a lot of things that we can do just in terms of our own posture and concentration. That has a lot to do with not only just exercise in the gym, Pilates, yoga, posture exercises, meditation. These are very, very important, not only for our spirit and our soul, but also for our bone structure and our posture. So we saw before, when our posture goes, it develops all these other physiological issues as well. And again, there are other issues that we can do. There's physical therapy, occupational therapy, weight reduction. We have a lot of resources open to us. It's really important. There's obviously surgery as a last resort when the joint or the bone is completely destructive. That's a result we want to avoid, okay? And basically, in conclusion, osteoporosis and arthritis affect a significant number of individuals, millions, probably over 100 million worldwide or even higher. Both males and females are affected, we know that, right? If not treated or managed, it can negatively impact our quality of life, we know that, we talked about that. Prevention of osteoporosis should begin in childhood, but a lot of us who are older can even start now, it's never too late. And again, arthritis can also be managed through healthier lifestyle choices and the proper supplementation. Okay? So with that in mind, I want to end it off here. I know I threw a lot of information, but if you got a few good pearls out of it, or some good things out of it, one of the things that you should understand is that these things are preventable. These are extremely destructive and dangerous, particularly with bone and joint health. And there's very simple modifications that we can do with certain supplementations, not only that we have here at FKC, but other supplementations as well, such as just multivitamins, such as Virginia that we have, lifestyle changes, some basic exercise parameters that could prevent or thwart us from having some severe issues with bones. So with that, I want to thank everybody out there, thank everybody here for coming, and I'll open the board for questions. And thanks, FKC, for having me. Thank you. Okay, we have a question. Yes.
You were saying that it can be reversed, the osteoporosis. To reverse it, you just do basically the same thing you do to prevent it.
Good question. Can it be, well, the question, it can't be reversed. We'll never go, reverse really isn't a fair word. I may have overstated it. You can slow down the progress, and yes, you can reverse it, but very slowly. You may not go back to when you were 20. But to the answer to your question is, no, you have to be more aggressive in terms of going back to once you have osteoporosis to lessen it or slow down the osteoporosis. You've got to really pick up the exercise program. You've got to do really the proper guidance of supervised exercise programs in terms of weight trainings. You have to be a little bit higher on the supplementation and these type of things, and definitely be drastic on weight loss, if that makes sense. So yes, you have to be more drastic once it happens. Just like with any other disease. If you have heart disease, you've had a heart attack, you have bypass surgery, from then on you have to really go strictly, much more stricter on your diet, salt, etc. Good question. But it can be done, yes.
Follow up with something like the Calcimag supplement. Is there something where you can get too much of it very easily, or is that kind of hard?
No, if you take the calcium, mag, vitamin D, the way it's recommended on the bottle, you shouldn't have too much of it, as long as your kidneys are functioning fine and all these type of things. You'll be able to urinate anything in excess. But those doses are safe doses that we've been using for a long time, and safe around the board that's used around as well, globally as well. Yes, good question though. And it's very simple. People just don't imagine this. They have all these issues in osteoporosis. Very simple. Some basic exercises, some nutritional changes, basic training, basic exercises with both weightlifting as well as aerobics, and just basic supplementation with the right proportion of calcium, magnesium, and vitamin D. It's pretty straightforward. Yes, any other questions? Yes, back there.
Yeah. Rheumatoid arthritis.
Yes.
Is it actually worse than osteoporosis?
Rheumatoid arthritis and osteoporosis, she's asking is it worse or whatever it is. But no, they're two different processes completely. One, basically arthritis is more in terms of inflammation. So the joints are inflamed. Osteoporosis is actually a thinning of the bones. So it's a different issue. Many of them go hand in hand. A lot of people have arthritic changes, whether it's rheumatoid or osteoarthritis, arthritis. Generally, many of them are older, will also have osteoporosis, which makes it worse. So not only their joints all inflamed and all that, they also have weak bones when they fall, so it's a double-edged sword. So the bottom line is that we package all these arthritic and bone health together because they're kind of the same, but they're not. Does that make sense? So arthritic is more the joint. And just one more thing, just to make it clearer, is rheumatoid arthritis. There's rheumatoid arthritis. There's a lot of different types of arthritis. There's rheumatoid arthritis and there's osteoarthritis. And a lot of people get confused on it. Rheumatoid arthritis is more of an autoimmune inflammatory disease where we don't know. And it usually affects the fingers and the hands, and you see people like that. Where osteoarthritis usually affects the larger joints and is not more of an autoimmune type thing. So they're treated a little bit differently. But again, the ultimate result is inflammation in between the joints that gives you the pain and the inflammation. Where osteoporosis is the weakening and less bone density of actual bones.
So what the
Yes.
calcium vitamins that we have can still actually benefit those that has that?
Oh, will it help for arthritis changes? In general, it'll help for arthritis change, so we also have joint again for the inflammation. Because, yes, yeah, you got joint again for that as well, But just so you know that rheumatoid arthritis is still an autoimmune disease, you can control it, but we still don't have a complete control of rheumatoid arthritis yet. Yes, you're very welcome. Thank you for the question. Any other questions? Okay, you're back there, then we'll go on. Yes.
Hi, my name is Jenny. I just
Hi, Jenny.
joined by the, I think it's a 1025B step.
Okay.
I take it, and after I take the supplement, and then my body have a reaction feeling like some areas like I feel a really sharp point, and then some area is like really like someone's massage inside there. So what's the difference? Is it good for me?
Oh, so you're saying you're having, after taking the package, I don't know what 1025B is, if someone can remind me what's in 1025B.
It's everything is yearly.
It's what, I'm sorry?
Everything except the
Regenesis.
Oh, okay, so you're having, you're saying you're getting kind of like a weird kind of feeling afterwards? Are you taking it with meals, before meals, after meals? How are you taking it all at one time?
Yes.
Well, I don't know the answer, but I can tell you there's a lot of solutions. A lot of people have different types of, sometimes these kind of different feelings when they take it. What I would do is I would space it out first of all and try to figure out, because it could be one of those pills that's giving it to you, not all of them. So I would space it out. So instead of taking them all at one time, try to take 2 at this time and see what happens there. If you don't get anything, then take the next 2 like a few hours later, and then you'll see you can try to